Are you tired of that persistent numbness or tingling in your feet? It's more than just annoying. It can impact every part of your day. Imagine waking up every day with that frustrating numbness and tingling in your feet. In this video, I will reveal surprising cause of numbness and tingling in the feet and an effective treatment that can provide immediate and lasting relief. From nerve compression to neuropathy, I'm going to break down the complex medical jargon into simple terms, give you actual steps so you can start taking both today. Over the past 24 years of treating patients with chronic spinal and degenerative conditions, I've identified 4 primary causes of numbness and tingling in the feet. I have helped over 11,000 patients improve their health and regain their mobility and comfort. In this video, I'll share these proven strategies with you and how to treat numbness and tingling in the feet safely and effectively without the need of drugs or surgery. In addition, I'll reveal 2 groundbreaking solutions for numbness and tingling in the feet: spinal decompression and laser therapy. These cutting-edge treatments have shown remarkable results in alleviating foot and leg discomfort. Plus, as a bonus, for watching to the end, I will give you 4 do-it-yourself strategies for relieving numbness and tingling. You don't want to miss them. Hi, I'm Dr. Chris Cameron, a chiropractor in Lucan, Ontario. I help people suffering from degenerative spinal conditions like back pain, neck pain, disc bulges, and disc herniation overcome their pain and improve their health and get back to activities they love, non-surgical corrective methods. I'm also a certified spinal decompression doctor. This channel is providing practical tips on managing neck pain, back pain, disc bulges, and other spinal degenerative conditions. Before I dive in, be sure to subscribe if you want to discover more tips on how to get well and stay well. I upload a new video every week. Numbness and tingling in the feet, sometimes described as a pins and needle sensation, occurs when nerves are compressed, damaged, or irritated. Anatomically, it means that there's an interruption in the normal spinal transmission between the feet and the brain. This sensation can be both frustrating and debilitating, making it difficult to walk, stand, or even rest comfortably. For many, it disrupts daily activities and can lead to a constant underlying worry about potential falls or further nerve damage. In my experience, I have seen 4 main causes of numbness and tingling in the feet: disc bulge, spinal stenosis, tunnel compression, and diabetes. A disc bulge and stenosis will place pressure on the nerve roots as they exit the spine. Tarsal tunnel compression occurs as the nerve passes by the ankle. Diabetic neuropathy is the most common cause of peripheral neuropathy and is caused when high levels of sugar and fats in the blood damage the nerves of the feet. There are other causes of peripheral neuropathy like vitamin B deficiency, thyroid issues, Lyme disease, and complications from chemotherapy, but these are far less common than diabetic neuropathy. Now that we know some common causes of numbness in the feet, how do we figure out what the cause is for your numbness? Let's start with peripheral neuropathies. If the numbness and tingling is in both feet, symmetrical in nature, and the symptoms don't change regardless of what you are doing, then it is likely peripheral neuropathy. For example, if there is no difference when you stand versus sit versus walking, then it's probably a peripheral neuropathy. If changing positions or walking makes a difference, then it can still be a peripheral neuropathy, but it's more likely that it's being caused by a spinal problem like a disc bulge or spinal stenosis. If standing makes the numbness in the feet worse, then that would indicate spinal stenosis may be the cause. If sitting makes the numbness worse, then that would indicate a bulged disc may be the cause. If you have numbness in the bottom of the foot, then we are looking at compression of the posterior tibial nerve. The 3 most common causes of this are pinched at S1 nerve root of the spine. This most commonly presents as pain in the butt and down the leg and into the bottom of the foot, but it can show up as only numbness in the bottom of the foot. The second most common cause is pressure on the sciatic nerve as it passes through the gluteal region. This usually shows up as pain down the leg and tingling in the foot, but it can also show up as just tingling in the bottom of the foot. The third cause is pressure on the tibial portion of the sciatic nerve as it passes through the tarsal tunnel. This is commonly referred to as tarsal tunnel syndrome and will cause pain, numbness, and tingling in the bottom of the foot. The most common cause of tarsal tunnel syndrome is flat feet, and a good pair of orthotics can be very helpful in this case. If there's compression at the top of the foot, the compression is generally happening on the peroneal nerve. There are 3 common causes of pressure. Number 1 is L5 nerve pressure at the root. This commonly presents as pain in the butt, down the leg, and the top of the foot. In some cases, this can be present as pain and numbness in the foot or top of the foot only. The second most common cause is pressure at the sciatic nerve that travels through the gluteal region. This can show up as pain in the butt, down the leg, and in the top of the foot as well. But it can also show up as pain or tingling in the top of the foot only. The third cause is compression of the peroneal nerve as it wraps around the outside of the knee. Before I share some do-it-yourself help strategies you can try home, let's talk about the available treatment options and what I think are the 2 best treatment methods for numbness and tingling in the foot. Common ones are medication, which are used for numbness and tingling in the leg, are gabapentin and pregabalin, but there are others that your family doctor may prescribe. Number 2, injections. Some doctors will opt for steroid injections into the spine to decrease inflammation. Number 3, physiotherapy is a common recommendation to strengthen the region. 4, massage can be effective when the compression is occurring in the gluteal region. The 5, chiropractic adjustments to the spine can be helpful if the problem is at the spinal nerve roots. While these treatment methods are popular, I have found that combining the next 2 therapies with either physiotherapy, massage, or chiropractic to provide the most benefit to patients with numbness and tingling in the feet. The 2 therapies I am referring to are spinal decompression combined with cold laser therapy. Spinal decompression works so well for tingling in the feet because the tingling in the feet is usually caused by nerve compression, herniated disc, or spinal stenosis. Spinal decompression therapy can help with this in 3 ways. Number 1, it reduces pressure on the nerve root that extend down to the feet. This is done by gently stretching the spine to create negative pressure in the disc. This retracts the herniated disc material back into the disc, relieving pressure on the nerve root. Number 2, improves blood flow. The decompression process enhances blood flow to the nerve root, bringing essential nutrients and oxygen to aid in the healing of the damaged discs and nerves. Number 3, rehydrates the disc by drawing fluid back into the disc to improve function and reduce nerve irritation. Cold laser therapy works in 3 different ways to help alleviate tingling in the feet. Number 1, cold laser therapy helps with inflammation around the affected nerve to reduce pressure on the nerve root. 2, laser therapy speeds up cellular repair and regeneration of the damaged nerve. 3, laser therapy helps to increase blood circulation to deliver essential nutrients and oxygen to the damaged nerve. This combination of spinal decompression and cold laser therapy addresses nerve root irritation to help reduce tingling in the feet. Now, as promised, here are 4 do-it-yourself strategies for relieving numbness and tingling in your feet. Number 1, diet is a powerful tool for reducing inflammation. This one area could be a 10-minute video in and of itself. If you would like to learn more about diet and inflammation, drop a comment down below and I will do a video on this in the future. 2 things that you can do right now with diet is reduce sugar and caffeine. Sugar and caffeine consumption both will cause inflammation in and around the nerve and the body itself. Diet is also a key factor in weight, and carrying around excess weight will put more pressure on the discs and the nerve roots. Number 2, exercise and stretching. Exercise and stretching are important, but you have to do the right one. I have a video of Blur all about this, and I will link it above. Number 3, blood sugar. Controlling blood sugar is important for more than just diabetic neuropathy. When blood sugar rises, so does inflammation, and chronic inflammation will cause symptoms to worsen. Number 4, posture is key. A tall, upright posture with a neutral pelvis will reduce pressure placed on the lower back discs. This will help to reduce tingling in the foot and many cases. I will put a link to a video I did on posture and bulging discs above. You now have a comprehensive guide to understanding the causes, symptoms, and treatment for numbness and tingling in the feet. Plus, you have 4 do-it-yourself strategies that can help provide relief and comfort. Now it's your turn. Tell me about your numbness and tingling. What has worked for you? What hasn't worked? Leave a comment down below to help build and support the community so we can all support each other through these health challenges and difficulties. If you found value in this video, please give it a like and share. By sharing the video, it helps the YouTube algorithm to know who to send it to. It can also help with people struggling with numbness and tingling in their feet. Remember to subscribe to the channel if you want to get more tips on how to get better and stay better. The next video you should watch is this one. 3 exercises for an L4-5 disc bulge. Go and watch the video now.